Thank you very much for joining again, and we welcome to the first module of non-technical skills for surgery in a variable source context. In this module, we are going to explore and discuss the situational awareness in the operating room. We expect that by the end of this module, you will be able to differentiate the three elements of situational awareness, identify observable behaviors of three elements of situational awareness, and identify the factors that negatively affect situational awareness, and describe how you improve your situational awareness in the operating room. Situational awareness can be defined as the understanding of an environment, its elements, and how it changes with respect to time or other factors. Situational awareness is important because of it's a prerequisite for effective decision making. So for you to be able to make appropriate decisions in the operating room, you have to know or understand what's going on. And simply put, the situational awareness can be described as knowing what is going around you and how it may affect the future state of the patient or the operation. Within the operating room, the approach of knowing what is going on consists of collecting data or information from the people around you, from the patient, either by looking at the vital signs from the monitors and looking at the equipment to see if the equipment is available and it is functioning. And as we do that, we have to continuously do that and also share the information we collect with other members of the team. And situation awareness is about developing and maintaining a dynamic awareness of the situation based on collecting data, understanding what it means, and thinking ahead about what might happen next. Again, within our non-technical skills framework, situation awareness is the first category, and it has three elements, and we will discuss each of the three elements in details in the future slides. So the situation awareness has three elements. These are gathering information, like here is like what is going on. Getting the information to understand what is going on. The information can be collected either from the operative fields by looking at the patient or in the operative fields, by looking at the equipment, seeing what is happening, what equipment is available, and what equipment is functioning or non-functioning. And the information can be collected by talking to other people. For example, the surgeon asks the nurse if the equipment is available, or the surgeon asks the anesthetist if the patient is doing well or stable, or for the anesthetist, ask the surgeon how much blood did the patient lose, or is the patient losing much blood. And then there's the so what, the understanding information. And when we collect the information, we have to interpret the information and so that we understand what's going on compared to the previous or existing status of the patient. And then the now what, or projecting future states. So for example, as a result of the current situation, what might happen if nothing is done? Some of the issues to consider in related to situation awareness is that in the operating room, there are a lot of things going on. There's a lot of information to collect, and things continuously change. So we have to focus on the information that is relevant and prioritize based on the status of the patient and the amount and the type of the information is there. For example, some people, for example, in the operating room may get distracted and by maybe someone, a phone call asking you for a consult on the patient who is admitted in the ward or at the emergency. If you are in a critical situation where you need to focus, maybe you can disregard or ignore that phone, responding to that phone call, and focus on the task at hand in the operating room. Some of the observable behaviors in the operating room related to situation awareness include scanning the environment, looking the environment, see what is available, what is not available, ask questions to other members of the team, and listen to them when they talk to you, and looking at the operative field, seeing the anatomy, seeing, for example, is the patient bleeding, or is the hemorrhage control. And you need to keep our ears open. So, for example, in the patient, when we hear on the monitors that the patient is high, the tachypneic, so you need to know maybe the patient has lost a lot of blood and something that needs to be done, or by touching, see, maybe putting pressure on the controlling to control the bleeding and so on. Some of examples of effective behaviors consist of collecting and tracking patient information, and actively seeking information from other members of the team, checking on the materials and equipment to see if they are available and functioning, and checking with members of the team to ensure that everybody is aware of what's going on. Ineffective behaviors, for example, if someone is aware of what is going on, or someone is distracted, is not focusing or following the steps of the operation. Failing to communicate, for example, failure to ask for questions, for example, a surgeon not asking the nurse if the equipment is available, or the nurse failing to ask for surgeon if what equipment they will need for the next steps of the operation. Or, for example, the surgeon failing to ask the anesthetist if the patient is stable, or the anesthetist noticing that the blood pressure is dropping and failing to ask the surgeon, like, how much blood did you lose? Also, there's failure to take actions. For example, in a given situation, if you notice that the patient is not stable, there are some things, some actions that needs to be done. For example, if the patient is hypotensive and has lost a large amount of blood, some of the steps, the initial steps may include increase the blood volume, the IV fluids volume. For example, giving boruses of IV fluids, normal, lingers directed or normal saline, and transfuse if necessary. The so what? So it's about understanding information. It consists of interpretation of the information and integrating the new information with our previous understanding of the situation, so may anticipate what might happen. For example, if you are operating in a patient who had a low or marginal hemoglobin, and during the operation, the patient becomes hypotensive, you may look at the suction machine or the causes to estimate the amount of blood loss and figure out that the reason why the patient is hypotensive is because they've lost a lot of blood. Then you may say the patient had the low hemoglobin before the operation. Now he has lost a large amount of blood. He is hypotensive, so it's not safe to proceed with the procedure before we fix the anemia or the hypotension. So some of the observable behaviors would, like verbalizing the current conceptual model, like what's going on, and state the serious nature of the given situation. For example, the patient is hypotensive, his preoperative hemoglobin was low, and he lost a lot of blood. If we don't transfuse, the patient may deteriorate. Some of the examples of effective and ineffective understanding information include, for example, interpreting effective behaviors include interpreting the information correctly and relaying and clarifying findings with the team to ensure that everybody understands the situation the same way, and to taking appropriate actions based on the information you have. Examples of ineffective understanding information behaviors include interpreting information incorrectly, not communicating with other members of the team to clarify findings of the team, or even within our examples of like the operating lab, failure to check that the failure to check the amount of blood loss, and failure to understand that low blood pressure means that the patient has lost a lot of blood, and failure to increase the intravenous fluid or transfuse uh, are examples of indicative of ineffective understanding information. The third element of situation awareness is projecting and anticipating future state. The surgeon, nurse, and anesthetist behaviors in projecting and anticipating future states include verbalizing possible plans to address the patient's safety threats and making preparations for the anticipated problem and predicting based on information gathered and checking and adjusting the timing of the procedure. For example, in our scenario, uh, the surgical team projecting and anticipating future state would include anticipating that the patient with low hemoglobin, with low blood pressure, preoperative hemoglobin will need transfusion, and they would order the blood transfusion. They should increase the flow of the IV fluids while waiting for starting transfusion, and the surgeons should apply measures to stop bleeding while waiting or during transfusion before proceeding with the operation. Examples of effective projecting and anticipating future states behaviors include anticipate that equipment medication will be needed, and predicting and communicating the turning points, which means that, for example, if the patient has risk of bleeding, we may say if the patient gets hypotensive, we need to start transfusion. And another example is to take actions to avoid or mitigate future problems. For example, uh, ensure that you minimize blood loss for that patient who you think had low hemoglobin for the operation. So ensure that you use adequate techniques so the blood loss is minimal. Examples of ineffective projecting and anticipating future state include not anticipating what might happen and the equipment or medication that will be needed, not staying engaged in the surgery, not for like getting distracted or not following closely all the steps of the procedure, and failure to call for blood or IV fluids when the patient needs resuscitation. And in our scenario, the team should have discussed when to initiate transfusion. For example, they would say if the patient becomes hypotensive, we will start transfusion. Some of the factors impacting our situation awareness or the situation awareness of the surgical team include the heart. If you are hungry, most of the time we spend many hours in the operating room and we don't get the time to take a rest and get lunch or breakfast. So when you are hungry, we are at risk of decreasing or having a poor situation awareness. When you are angry, so when you are sad or angry or something is not going on, this affects our situation awareness. When we are late or when we are due to time pressure or think you want to finish this patient, we operate on this patient quickly, and so on. There are some information we may fail to correct. And when we are tired, so when our brain or we are physically tired, this affects to uh, this affects our ability to maintain effective situation awareness. So we have to be aware of like being hungry, angry, late, and tired. And if we are in this situation, find maybe other approaches we can use to improve our situation awareness. However, there is also one strategy that we can use to improve the situation awareness in the operating room. It is this, excuse me, the acronym called STOP. So this STOP acronym was developed, I think, in Europe, and it was found to be associated with improved situation awareness and teamwork in the operating room, which also resulted in decreasing post-operative complication. So what does STOP mean? ST, the first ST, STOP, is the status of the operation. So during the operation, the surgeon or the doctor leading the team uh, take a short break. This can be 1 minute or a few minutes to update the team about the status of the operation. Saying, for example, if you are doing a cesarean section, the doctor can say, now we have extracted the fetus, the uterus looks good, uh, there's no active bleeding, and then they describe the objective. Then the objective, the next step of the operation we are going to do to suture the uterus and uh, close the abdominal wound. And possible problems, the things we have to look for is that maybe we have to continuously check if there is no active bleeding and control the bleeding. And maybe in the case of cesarean section is also to take care of the neonate that was just born. And P, there's a possible problems to look for. And the question mark is to invite other members of the team to share their opinion. So if there's anyone who has a problem or concern, please share your opinion. So this can be done many times as you want, depending on the type of the operation. And it is short, it doesn't increase like the length of the procedure or the fatigue and so on. So next we are going to do to watch a simulation-based video. So while watch the video, focus on the situation awareness, the elements of situation awareness. These are gathering information, understanding information, projecting and anticipating future state. And the case is about a laparotomy for a suspected perforated gastric ulcer. We have a 64-year-old male presented with abdominal pain, and he had an abdominal x-ray that revealed free air under the diaphragm, which may indicate a perforated gastric. So watch the video, then we'll meet again after the video. So the purpose is to watch the video. As you watch the video, assess the situation awareness of the surgeon, the nurse, and the anesthetist, and later after the video, you will discuss in group what you observed as examples of effective or ineffective non-technical skills behavior within category of situation awareness. So thank you. I hope that you enjoyed this video. So this was a simulation-based video. So next step is to ask you to identify, based on what you observed in the video, identify surgeons, nurses, and anesthetists' behaviors of situation awareness in gathering information, understanding information, projecting and anticipating future state. And how would you describe them as either effective or ineffective? So here we take a few minutes, maybe 10, 15 minutes to discuss the behaviors, and then some of the examples of behaviors we observed is that the surgeon's alive delayed and he was lashed. And in understanding information, he was dismissing the information from the anesthetist about the low hemoglobin and the patient being cachectic, and dismissed the information from the resident about like when the resident was concerned that there is a tumor, but initially the surgeon was dismissing the information and so on. And ineffective behaviors in projecting and anticipating future states is about failing to consider consequence of manipulating the tumor, that tumor if you manipulate may bleed. Not anticipating that the team may need ICU, the patient may need ICU after surgery, or failure to book the blood before surgery so that the patient can get transfused if needed. And when the surgeon noticed that the patient was deteriorating, he asked like if the ICU bed is ready, but he didn't anticipate and communicate with the nurse and anesthetist that they will need the ICU bed. So in summary, situation awareness is about developing and maintaining a dynamic awareness of the situation based on the assembling information from the environment and understanding what the information mean and think ahead about what may happen next. So thank you very much, and I look forward to meeting you during the next module.